Nurses in Nigeria have adopted a 5-year strategic plan to ensure qualitative and affordable healthcare delivery to reduce mortality associated with surgical interventions. Mrs. Olubunmi Lawal-Aiyedun, North Coordinator, National Surgical, Obstetric, Anesthesia and Nursing Plan (NSUP), disclosed this at a 5-day train-the-trainer workshop held in Abuja. The workshop was organized by NSUP in partnership with Smile Train. According to Lawal-Aiyedun, the aim of the training, tagged "Nursing Care Saves Lives," is to promote quality, timely and affordable surgical intervention in Nigeria.
The National Surgical, Obstetric, Anesthesia and Nursing Plan is actually a global movement. But I'm proud to say that it's only Nigeria that have nursing integrated in NSUP. But what we are doing today is to create awareness on the need to promote surgical services that are of quality, high quality, timely, available without financial burden. That is the narrative we want to change right now. And we know that doing that through nurses in this country as a nation, we can actually improve the services at all levels of service delivery.
According to her, surgical intervention is critical in the efforts to achieve universal health coverage, hence the launch of NSUP as an intervention in 2019 by the government.
In 2017, the planning commenced, and in 2019, the Federal Ministry of Health actually launched this into use for the nation. So that is a foundation, and that is what we are also celebrating. Of course, we also want government to do more. We want them to have a budget for NSUP. We want them to also implement NSUP, because just the way our partners Smile Train have done supporting the implementation of NSUP.
In her remarks, Dr. Omolora Williams, pediatric surgeon, Lagos State University Teaching Hospital, LASUTH, identified infection prevention and control as an essential aspect of surgical care that would promote and improve outcomes in patients.
So every stakeholder has to be committed in ensuring that we control infections and on our wards, in our theaters, in everything we do within the healthcare space. Doctors and nurses constitute the medical team, the surgical team, and so that is why we have National Surgical, Obstetrics, Anesthesia and Nursing Plan. So everyone will work together to promote our National Surgical Plan, to ensure that we implement our National Surgical Plan, our strategic priorities for surgical care.
Mrs. Victoria Awase, Program Manager, Smile Train, West Africa, said the aim of the sponsorship was to empower local medical professionals to give better care to Nigerians.
The reason for sponsoring this program is to empower our local medical professional, which is the policy of Smile Train, to teach a man how to fish. Because if you look at Nigeria today, we are more or less having brain drain. But if we empower our local medical professionals, they will render the good services that will go to other countries to get.
A participant, a staff member of Federal Teaching Hospital Gombe, while appreciating NSUP committee and sponsors of the program, said the training had enhanced his capacity.
I came here, I had a lot of expectations, and I want to thank God that NSUP, Smile Train, by way of putting up this training, my capacity has been enhanced positively, which I also intend to go back and ensure that I step it down, because this knowledge, I will not leave it to myself alone. I must, step it down for others to benefit from it.
Highlight of the event was cutting of cake to mark the maiden edition of NSUP and awarding certificates to members for their outstanding performance.